Welcome to Tony Martignetti Nonprofit Radio coverage of bbcon 2012. We're in Maryland, just outside Washington, D.C. My guests are Nancy Johnson. She's a senior consultant with Target Analytics, a Blackbaud company, and Bill McGinly, president and CEO of the Association for Healthcare Philanthropy. Both of you, Nancy, Bill, welcome.
Thank you.
Thanks for taking time on a busy day.
Delighted.
Fun day.
Your seminar topic is best practices for successful healthcare fundraising, how to strategically grow your Grateful Patient program. Bill, president and CEO of the Association for Healthcare Philanthropy. I like to get the articles right.
That got you thrown.
The details are important. Okay. I like the articles.
All right.
Why is a Grateful Patient program critical to healthcare fundraising?
Sure.
Let's start at the basics.
In healthcare, in our group particularly, as we're representing providers, hospitals, medical centers, long-term care, hospice, and such, the group that is connected, that has had an experience, that has been touched by the provider is a very important group. They're very generous. They are involved. They know what the organization is about and what it can provide. So they are more generous than the average member of the public, simply because they've had an experience with the institution and they know what it's like. They are a major part of the family, which is the physicians, the employees, the governance, the executive, the trustees of the hospital, and grateful patients. They represent over 55% of individuals that give to healthcare. So they're essential for us, and they're big givers.
Help me understand why they're not unapproachable because of privacy laws.
Well, they are very approachable, and the privacy laws allow the healthcare provider access to demographic information. So names, addresses of patients are part of what we do internally for our fundraising. And that's perfectly acceptable.
So it's acceptable for the clinician to share with the development office, is that right?
The physician at a hospital, the nurse, the janitor can refer a name to the foundation for somebody who might be interested to give.
Okay.
It's perfectly acceptable and permissible under the law.
And Nancy, why don't we start with some of the tips that you have for growing this very important Grateful Patient program. 55% of individual fundraising to healthcare is from these people. How do we get started?
Absolutely. Well, one of the main objectives is to be able to find the people that are in the hospital immediately so that the foundation can really approach them. Not approach them for a gift. I'm coming to say hello. I'm introducing you to the foundation and letting you know that our goal at the foundation is to increase the awareness of what we do to help raise more money. Mm-hmm. And so what we see is the opportunity to find the best people to make the right gift at the right time. And what we're doing is identifying the people that are most capable, as well as the people that are already connected.
And how do we start that conversation, though? Once we've identified the people, how do we initiate the conversation?
While they're in the hospital, it's a quick hello. I want to connect with you. Now, if you're already a donor, I've been wanting to meet you. You've probably been wanting to meet me. We've maybe met at events. We're friends. So you would expect me to come by and say hello to you.
Oh, so these are people, we're starting with the premise that these are people who are already known to the hospital.
Oftentimes they are.
Okay.
Other times you're a new prospect, a new patient that's just came to the hospital. And what's important is to let them understand and know that we have a foundation that will be working with them for the future.
Okay. Bill, what do you hear from fundraising professionals in hospitals about making that initial contact?
Sure.
What kinds of responses are patients willing to talk?
Oh, very much so. And when our members are making these visits, they're rounding and they're in the room with a patient. One of the things they're offering to do is they are a contact for you. Anyone that comes into a hospital to have a procedure, that is very unique for the individual. It may be a bit routine for some of the providers. Our member really steps across that gap in providing as a resource, answering questions, someone they can turn to for communication to make sure that they're comfortable with what they're receiving and the kinds of things that they're going to undergo and experience while they're in the hospital. Because it is a foreign land to anybody who's a patient who's coming in for the first time.
Scary.
It can be, absolutely. Right? It's unknown. And while, again, it's very routine for the providers in the sense that they live there, they work there, it is a unique experience for any patient who's coming in.
And Nancy, I took you on a slight digression, how to make the contact once we've identified, but what's your advice around doing the identification of current patients?
Absolutely. We have a process that is totally automated, so no human hands is touching the data.
Now, and we is the Blackbaud.
We as Blackbaud
product,
Target Analytics.
Target Analytics, okay.
Many of our clients use Razor's Edge as their donor management system, so many of their donors are already known, and we compare the names of the new admits to their database as well as to a wealth program. And we're putting a rating, letting them know the best prospects for major gifts, the best prospects for annual giving, and that allows them then to make a decision if they should go visit,
okay,
and or put them into an annual solicitation program.
All right. Did you want to add something, Bill?
Well, and even better yet, if we're visiting someone that we know that is a major gift donor, it is reestablishing that contact with them and maintaining their interest in the programs and their opportunity to support activities that are beneficial for others in their community.
This is an opportunity for the foundation to reach out to people with them in the hospital. So I look at it as they're coming to visit you. They're there. If you don't reach out and say hello to them after you've had a relationship for years, it's not really good. I want to say at least hello. It's not going to be a long visit,
okay,
but I'm reaching out to you.
And what if it is someone who's new to the hospital, not part of the family, not someone you've known for years? Still appropriate to greet them while they're in the hospital?
Absolutely. I believe that most people, when they're in the hospital, they're experiencing something unique. It may be the first time they've known about the hospital. They become part of the healthcare family there. And by reaching out to them, they expect it's a hello. Here's a discount for the gift shop, or maybe I'm going to leave the newspaper behind for you. I come in with a friendly face. I'm not bringing in needles, and I'm not taking blood from you, and it's a quick hi.
Okay, okay. But go ahead, Bill.
I found it interesting what Nancy said in the session earlier today was that these people are coming to your home. They're coming to the hospital, our home. They're coming into our facility. And there are, any experience you have in the hospital, there are 5, 10, 15 people that are in and out that are touching your life during that process. And to have one focal point that can be helpful that you know you can turn to if you've got questions, or a spot that you can go to, a person you can go to facilitate communication and make sure it's clear among all these services that are being provided, is very much appreciated by patients. That's what we find.
So you're encouraging the fundraiser to act as a resource.
Yes,
for the patient.
Oftentimes they do, and it's quite appreciated, as we know.
All right. So then, after we've identified, we've initiated contact, Bill, what's another strategy for growing this program?
Well, that's part of what we were talking about today. There are different levels of grateful patient programs.
Okay.
At the very basic level, you find that contact, that call being made, that introduction. And it may be 60 or 90 days later where we're looking at that individual and deciding, is this someone we want to make an appeal to or reach out to about some program or service that we're offering where their donation can help someone else? Is it someone who's contributed in the past or who has the capacity to do more? Do we want to put them, do we want to put an effort in front of them or an opportunity in front of them as a major donor where they can make a significant difference because of their contribution to the community? And, you know, that's very basic. There are others where you're doing the analysis and the analytics, if you will. You're assessing wealth management and capacity so that when you talk with somebody, you develop a relationship, you clarify their interests, and also the level at which you believe they can support a particular activity in helping others.
Now, Nancy, you're going to have to forgive me because I'm going to ask Bill about what some advice for a hospital that may not have Razor's Edge. So
There are some.
I don't want you to walk away. I don't want you to leave the conversation. But I'm just thinking of our audience as small and mid-sized charities, and there might be a smaller hospital that doesn't have Razor's Edge.
Identifying...
you want to do it? All right, and then we'll turn to Bill also. Okay. No, good.
Identifying grateful patients, we often we compare to their database, no matter what it is. And so it doesn't they don't have to be a Razor's Edge user. The idea is we're helping them identify grateful patients and look into the patients that are there so that they're contributing to their experience.
Okay.
So it's a step.
There would have to be a mechanism for sharing the information from I don't know if it's admissions or clinicians.
It comes from admissions typically.
Okay.
It comes from admissions, and then it's submitted, and no one really has to touch it. It's electronically done. We screen it, and then the results are back within 90 minutes, so that the foundation can decide, okay, who's the best person to go visit this person?
Okay. Go ahead, Bill.
Well, and our members are clearly using Razor's Edge as a tool. And one of the best advantages of this as a tool is simply that it expands our members' capability beyond. It may be able to multiply the impact one person can have to twice as much or 3 times as much, because some of it's automated, but it's more instantaneous than operating off of written records. The comparisons that you're making relative to wealth management to an individual who's in the hospital or who has been discharged is instantaneous, as opposed to trying to make all those connections in your head. So this tool really expands our members' capacity for getting to more donors this way, and that's invaluable.
Okay. Bill, do you have specific advice for smaller hospitals, healthcare facilities that whether they're using Razor's Edge or not? Is it an advantage to be a smaller, maybe community hospital?
Well, it's so much like everything you've heard around the world. All fundraising is local, and it is individual in many respects. And again, Razor's Edge is a tool that enables that capacity. If you don't have Razor's Edge, there are some other alternatives and things you can do, all the way back to when I started, when it was index cards in a shoebox.
Okay.
But it's that kind of approach. So there are things in between. Certainly Razor's Edge is sophisticated, and really the value is really in expanding the capability. But there are other ways you can do that. Part of it is more manpower, which is hard to get in smaller organizations. Part of it is a process and dedication to that process every day, no matter what the elements are that you put in place. So you can make it work. It may not be quite as effective without some of these tools, but it's still going to work.
Okay, so the smaller community, what I'm familiar with, the smaller community hospital shouldn't avoid a grateful patient program.
No, not at all.
Absolutely not.
If you're a foundation executive, this fundraising is part of your obligation, your purpose, and it's within the healthcare community. These are institutionally related foundations to the hospital.
Right.
They're not out raising money for the something else in the community. It's focused on delivery.
Of the hospital. Yeah.
Absolutely.
Okay. Yeah. Go ahead, Nancy.
Tony, another area that we offer at Blackbaud, we want to be able to help all sizes of nonprofits. So eTapestry is a wonderful solution that is many times used for the smaller community hospitals.
eTapestry, is that a cloud-based
It is. Yes, it is.
Okay.
And so we know, history tells us, we've worked together many, many years, that many of the hospitals use Razor's Edge. But like you say, some of the smaller, newer hospitals, maybe they don't need the sophistication, and we have a wonderful opportunity for them to use eTapestry.
Okay. Sure. Let's talk about some other advice around go back to building this Grateful Patient program. Nancy, what further advice did you give in your seminar we haven't talked about?
Well, each hospital is unique, and when they start looking at what makes the program different, it's getting buy-in from the whole healthcare community, from the top all the way to the janitor that's in the room with someone. The foundation needs to be more than the organization, the part of the organization that says, hey, do you want to how much are you going to give to the employee program this year. We want to make sure that the foundation is connecting with the nurses, the people that are front line with the patients, and making sure that we're hearing, hey, you need to stop in and have a visit. We need to make sure that we're introducing grateful patient programs that can enhance all the different areas of the hospital so that everyone's understanding those programs.
Yeah.
And bringing the community together, because really it's all about the services that we're providing to these healthcare.
What's your advice about getting the clinicians involved in fundraising? First, they're busy. What I hear and my experience in doing some planned giving consulting for hospitals is docs are typically, well, I don't know typically, a good number of doctors are not willing to partner really with the fundraising, with the development office or the foundation. What's your advice for sort of breaking down those walls?
I think when you really start involving the whole team and you have a new approach, and it may be a totally new approach, you have to think outside of what you have done in the past. Healthcare we're having to raise more dollars every year. And when you're asked to raise more dollars with less, you've got to use the right technology.
What's a new approach? Help the audience understand what's one new approach that they can go to their doctors with.
By implementing this information so that I can focus within 90 minutes and be able to be next to someone and introducing all the good work we do.
Okay.
That makes it takes the guesswork out. It allows me to be more focused, and then it also allows the doctors to have the opportunity to refer people to us and a system in place so that they know as a team we're working together.
Bill, do you have advice for breaking down those walls, getting to those doctors who are often unwilling?
And it's not just the doctors. You're talking about building a culture of philanthropy and awareness
throughout the community,
okay?
Right? As Nancy was saying,
you do that with the orientation with new and ongoing employees that you have. You do that in the training opportunities with the nurses and with the practitioners and such. That you're talking about philanthropy. You're letting them know about the foundation. With the physicians, they're human beings too. You need to embrace them the way you do others. And there are programs and activities that can be very supportive of areas that they are interested in, either in their specialty or in pieces of equipment or things that are going to make their delivery of care much higher to their patients. So sometimes it has to be very specific for them.
Helping them see what the foundation can do for them if they're willing to partner.
And I mentioned that family of donors. The physicians are a large portion of that.
Right.
It's not every physician, though, but it's the ones that turn on to see the fact that, hey, getting involved this way and even being philanthropic myself, which if I do it through planned giving or some other vehicles can benefit me indirectly, that has a meaningful impact on my patients. And that's where doctors focus. It's all about them and their patients, it seems to me.
So if we can bring it down to the patient care level, the benefits of working with the foundation, making those clear. Go ahead.
And one other element that struck me is that in that culture of philanthropy, what you want to get it to is a point in the overall institution that this isn't something that's nice to have. This is something that's essential, that needs to be elevated to the strategic level of the planning of the whole hospital, so that the executives on the hospital side are learning to plan for and depend upon and demand that philanthropy be a major part of their business and what they're trying to do for the community.
It has to come from leadership, right?
Absolutely.
Creating this culture.
And we see in our benchmarking service that we do with the standards where you have the CEO of the hospital involved in an active way in signing letters and being present and making some of the calls with you as appropriate, you're getting a much better result and a much better return on the dollars that are being raised, because donors want to know that they're having an impact and the important people in this business are aware of what they're doing.
And Bill, I think we've seen that change over the years. The two of us sitting in these seats have watched healthcare philanthropy change enormously.
Excellent. We have to leave it there. I want to thank Nancy Johnson, Senior Consultant with Target Analytics, and Bill McGinly, President and CEO of the Association for Healthcare Philanthropy. Thanks very much for being guests.
Thank you.
Very good.
It's been a pleasure.
But
Thank
I'm
you.
not done.
You are. You don't know.
I'm
you
done.
are. Tony Martignetti, nonprofit radio coverage of bbcon 2012. We'll be back with additional guests, and you'll hear further segments. Stay with us.